Everybody, thank you all for coming today. I'm Dr. Tom Farley, the city's health commissioner, and we're here to talk again about health care. For 7 years, the Republicans in Congress have talked about their desire to repeal and replace Obamacare, but they've never had a decent plan to what to replace it with. The other plans that they've put forward have failed, and they have a new plan that is called the Cassidy-Graham bill, which is the worst yet. So we have a number of people here today who to talk about its impact on Philadelphia. But first I want to just frame what this bill does so everyone understands the basic structure of it. The Cassidy-Graham bill does three things. First, it ends a variety of federal protections for health insurance. So there would be, for example, no requirement that employers offer health insurance to their employees. So many people who get health insurance to the job would lose it. There'll be no federal requirement that people with pre-existing conditions have affordable health insurance. There'll be no federal requirement for essential health benefits, which may mean that maternity care is not covered by health insurance. Second thing it does is it turns over the job of organizing the complicated healthcare system to 50 different states. That includes the entire Medicaid program and includes the individual exchanges. So I have to ask this question: would you trust the Pennsylvania legislature to reform the healthcare system here when they can't even pass a budget? The third thing it does is it cuts the funding for Medicaid. That would cut it by perhaps as much as $1 billion a year to Pennsylvania, and it redirects most of that to other states that refuse to expand the Medicaid program to help their working families, like South Carolina. Now, with these cuts, the state's going to be forced to make tough decisions and cut an awful lot of people off of Medicaid and reduce services for people who are still on Medicaid. And that's particularly important for Philadelphia because here in Philadelphia, 650,000 people are insured through Medicaid. That's 40% of the entire city. And remember, when you're not thinking about individual people, health insurance can make the difference between life and death. So it's a terrible plan, but don't take it just from me. Also at the national level, take it from other people who looked at this. Who was against it? Doctors, hospitals, insurance plans, and patients. Basically, everybody who knows anything about the healthcare system is against it. So we are against it here, and there's a group of people who are going to talk more about its impact here on Philadelphia. And I want to introduce first our mayor, Jim Kenney.
Thank you very much, and good morning, everyone. We are here today because the new administration in Washington wants to repeal the Affordable Care Act, which is also called Obamacare. The first step in doing so has already taken place. This month, members of the Senate GOP presented the Graham-Cassidy health care bill. This bill is nothing more than a big tax cut for the rich at the cost of low and middle income families. This bill would cut Medicaid, defund Planned Parenthood, and replace assistance to lower income people to buy health insurance with tax credits for the rich, ultimately leading to many Philadelphians losing their health insurance and increasing the amount they pay out of pocket for it. More than 200,000 Philadelphians have gained health coverage through ACA, over 160,000 through Medicaid, and 60,000 through the marketplace. The Affordable Care Act has enabled 160,000 Philadelphians to receive treatment for mental illness or substance use through the Medicaid behavioral health program, not to mention the 20,000 jobs created in Philadelphia's healthcare and education sectors. And for the first time in 50 years, there would be a cap on federal funding for Medicaid, leaving fewer people covered by Medicaid and providing fewer services to those who still receive coverage. The bill also defunds Planned Parenthood, which would deprive thousands of women in Philadelphia of the preventive health services they are currently receiving. And one final point: people who are healthy and well off can always get health insurance coverage in this country. What the Affordable Care Act does is make sure that health insurance coverage isn't only for them, but is also available to those who are less fortunate. That is, people who don't make a lot of money, or people who are already sick, or people who might become sick. This is the wealthiest country in the world. Other countries with far weaker economies than ours provide medical care for everyone. And the Affordable Care Act showed that the United States can cover everyone too. We owe it to those people who are less fortunate not to take this coverage away from them. The Graham-Cassidy bill is just more of what we experienced before, and frankly, we can do better, and we owe it to the people of the United States to make sure that that happens. And I mean, it's like everything that comes out of Washington these days, or out of the White House, is just seemingly insane, from this new spectacle with the NFL and the NBA. It's actually an embarrassment that the president speaks the way he does and says the things that he does. It's an embarrassment to me personally as a 59-year-old lifelong Philadelphian and American. This Graham-Cassidy thing, and I don't always agree with everything John McCain has said or done, but I got to give him credit. He has stood strong and tall about this, and hopefully this will not happen, even though we think it might be dead again. We need to make sure we keep people's attention focused on the issue, because trust me, they'll be back again. If this one fails, they'll be back again. Their donors are clamoring for more money and tax cuts, and that's what they listen to. So who's next? Thank you.
Thank you. I say among the biggest and most troubling impacts of this bill on Philadelphia would be impact on people with mental illness, and substance use. So here to speak to that is my colleague, Commissioner David Jones from the Department of Behavioral Health and Intellectual Disability Services. Excuse me.
Thank you, Mayor and Dr. Farley. Good morning, everyone. It's been stated, and it bears repeating, that more than 200,000 Philadelphians benefit from the Affordable Care Act, more than 160,000 through Medicaid expansion. And again, as was said, the Department of Behavioral Health and Intellectual Disability Services via Community Behavioral Health administers the health plan that covers mental health and substance use disorder services. Of the over 1.5 million people that populate Philadelphia, over 600,000 are enrolled in Community Behavioral Health's Medicaid plan, and approximately 20% are utilizing essential mental health and substance use disorder services at any given time. The latest ACA repeal and replace effort is without question the most devastating plan we've seen, and a true attempt to deprive too many people of what we believe is a basic human right. Without the ACA, we'll see thousands of uninsured and underinsured people go without the support they need, and let's be clear, the collateral damage to families could be catastrophic. Even President Trump, whose behavior can be, I think, characterized at times as a bit impulsive and fickle, had the insight to say that the opioid epidemic should be labeled an epidemic. The ACA could actually repeal the opioid epidemic, and substance use disorder treatment that we're using to combat the opioid epidemic would go away. We've actually seen over 900 overdose deaths in 2016, and we unfortunately may be on pace to see over 1,200 opioid-related deaths in 2017. Moreover, what we know is that behavioral health and substance use disorder treatment, when paired with evidence-based practices, has a positive effect on social determinants of health. Social determinants of health like housing, employment, and food security. Medicaid funding has been extremely helpful in our efforts to increase supportive housing, yet this proposed plan would drastically impact the work designed to end chronic homelessness. All of us here are committed to helping all Philadelphians, but we need the support of Congress in doing so. And we urge them to consider the countless lives that will be negatively impacted if Cassidy-Graham proposal is passed. We certainly encourage you to contact Senators Casey and Toomey to vote no on this proposed legislation, similar to what we've heard that McCain out of Arizona will do. We are really at a vital time where, if this legislation moves forward, it's the tipping point in terms of the number of people who could dramatically be impacted. And I do want to underscore this idea around the opioid epidemic. The fact is that the mayor moved us forward with a task force of a number of, I think, very brilliant people We certainly looked at the science, came up with 18 recommendations. We're moving forward on implementing those recommendations, and candidly, turning back now, again, I will tell you, would have really catastrophic effects. So I'll stop there and turn it back over to Dr. Farley.
We're fortunate to be represented in Washington by some people who do understand the importance of health care. And here with us today, we have Congressman Dwight Evans.
Thank you very much. Good morning to all of you, and I say good morning. And I thank the mayor for his leadership and all of the people that he has brought together. This is extremely essential. It's rather ironic for the time we sit where we are, because it is in this city 2 years ago that the president made a statement, which I will repeat to you. The statement that the president made is, what is the hell that you have to lose? That's exactly what he said it. He said it at like Vine and right off of Vine and Broad Street. And he made that challenge to Philadelphia 2 years ago when he was running for president and making that statement. Well, you have heard from all the various experts. You have heard that we could lose the health care and the impact that it has on this city. With what the mayor is attempting to do with rebuilding in terms of neighborhoods and pre-K and all those things, there's a direct connection between taking away people's health care in terms of the progress that this administration is attempting to make. I didn't go to Washington to be a problem to the people of this city and to this country. I went to Washington to make a difference. This is not governing, this is campaigning. This is concentrating on the basis. So I want to say something very clear. Now, I'm not speaking for Senator Casey, but I know he will do the right thing. You need to call Senator Toomey. You need to email him, you need to send a message. You can't sit, this is a contact sport. You can't be a spectator. And I think that the reason the mayor is bringing this together, all of us together today, is we got to get into this contact sport. We can't sit and be spectators, because an awful lot of people will be affected. First and foremost, the people, and secondly, in terms of workers. And when the health commissioner spoke about Harrisburg, I have a little experience about Harrisburg. When he raised the question about Harrisburg's ability to do things, now, come on, folks. I was there for many years, and I can tell you it was a fight every day. So between Harrisburg and Washington, D.C., and all that you are trying to do in the city of Philadelphia, it doesn't make any sense. So I'm stressing to you, phone calls, social media, every tool that you have available, this is far from over. We cannot take it for granted. So we need you to stay with it. Thank you very much.
Thank you. You heard Commissioner Jones talk about the impact of this bill on the opioid crisis. That's going to have an impact on our homeless population. Here to talk more about that is Commissioner Liz Hirsch from the Office of Homeless Services.
It's hard to follow, Dwight, isn't it? So we in the Office of Homeless Services throughout the city of Philadelphia employ an evidence-based practice called permanent supportive housing. And this couples services that are wrapped around individuals, generally who have been chronically homeless, who have mental illness and likely have a substance use disorder, and we combine it with a rent subsidy so that they have a place to live and the supports they need to remain stable. And this evidence-based practice called supportive housing is on average 90% successful in preventing a return to homelessness. And this represents about 8,000 units helping formerly homeless people remain stable and contribute to our community. Those wraparound services that undergird this evidence-based practice are largely, if not entirely, funded by Medicaid. So eliminating the entitlement to those behavioral health services, reducing the availability of those services will mean that people who are currently stably housed may not be able to sustain that housing, and people who are currently on the street, who we know have a 90% chance of being successful if they were to get that permanent supportive housing, that service will not be available to them. Therefore, one of the hidden impacts of this bill is that we will see an increase in the suffering that is caused by chronic street homelessness. This is a program that works. We do not want to see Congress dismantle an approach to ending the terrible tragedy and suffering of homeless that is effectively helping so many of our citizens and could help so many more. Thank you.
Thank you. And now, someone who understands the impact from the perspective of a healthcare provider, someone who offers healthcare services, we have Monica Medina McCurdy, who is the Vice President for Healthcare Services at Project Home.
Good morning. Thank you, Mayor Kenny and your staff for holding this press conference and shining a light on this critical issue. I just want to make 3 points. First, this is going to be devastating for not only Project Home, but for the whole city. What we see in our health center at Project Home are many people who are receiving Medicaid who otherwise were not eligible for it pre-ACA. And we've worked with a lot of folks, as Liz mentioned, who have experienced homelessness. So imagine you have overcome homelessness, you've achieved permanent supportive housing, you are getting medication for your serious mental illness, you are in recovery, you have a serious physical disability or illness that you're also grappling with, and you were able to get health insurance through expanded Medicaid. Now that goes away, and all of those supports and ways for that person to deal with the devastating experience of homelessness and all of those really health issues also goes away. Secondly, we're a community health center. Project Home's a community health center. We're part of a very robust network, a health center network. We're the safety net, a critical part of the safety net here in Philadelphia. We provide affordable, high-quality care. This bill completely undercuts our work, and not only our work, but all of the jobs that we were able to create. Just in our health center alone, we went from 1 employee to 40 employees. Many employees come from the community that we're serving. Some of them have experienced homelessness. Some of them we're in North Philadelphia, some of them live in North Philadelphia right in the neighborhood. This is a bill that will devastate not only people in terms of health care, but could also is threatening jobs. And lastly, health centers have been seen as bipartisan, or I would say nonpartisan. Health centers across the country have enjoyed that support from both sides of the aisle. This bill undercuts those relationships that have developed over decades. Health centers have been around for more than 30 years. We have terrific relationships at the federal, state, and local levels. We have great relationships with Medicaid managed care organizations. And this bill basically cuts the knees off of all of that relationship building, all of that network building that has been built up over the years. When it comes to healthcare for all Americans, there's really no such thing as my side of the boat is not sinking. Our country cannot prosper if our ship takes on the water of more than 30 million people losing health insurance. But there's something we can do about it, and as Congressman Evans says, we need to stay in the game, we need to stay focused, contact our senators. Project Home's website, www.projecthome.org, has a very easy way for people to do 2 clicks, and you send your message to Senator Toomey or wherever your senator or congressman is located. So we have to take action, we have to be loud, and we have to speak up for all the devastating ways that this bill could have in our country. Thank you.
Thank you. One of the first things that would fall apart under this bill is the health exchange. I'm here to talk about the impact of the health insurance exchange on herself personally, who puts a human face behind it. We have Kalina Stewart.
Good morning, everyone. My name is Kalina Stewart. I am a home care worker from Philadelphia and a member of United Home Care Workers of Pennsylvania and SEIU. I am here because I am afraid of what attack this could have on the ACA and Medicaid, who to millions of Americans who, like me, rely on care through the ACA and pre-existing condition protections. I am afraid of what it would mean for millions of seniors and people with disabilities who rely on Medicaid-funded home health care. My mother was a CNA all of my life. Caring is in our blood. I always vowed to her that I would never put her in a nursing home. I didn't trust anyone else to give her the care that I could give her. So when my mom got sick in 2006, I had to quit my job in the ER to take care of her. My mom recently passed away at the age of 82. Because of my decision, she was able to live a longer, more comfortable life. While home care pays poverty wages and we desperately need a raise, it pays something. That's what allowed me to make the choice to leave my job to care for my mother full time. Senator Toomey says this plan is necessary to increase in freedom and choice in health care, but it does the opposite. Cutting Medicaid funds means cutting hours for home care consumers and cutting wages for home care workers. For families across Pennsylvania, it will take away the choice my mom and I made. Seniors and people with disabilities would not easily stay in their own homes and live a normal life with a little help, but be put into nursing homes, taking away their freedom. When I started as a home care worker, I didn't have any health coverage, so I turned to Obamacare when it started. Because I have a history of fibroids and needed surgery, that was essential for me. So all the senators who will be voting on this bill, especially our own Senator Toomey, what if your loved one needed some help with daily activities but wanted to stay in their own home? Would you force them into a nursing home? What if they couldn't get insurance because they had a history of fibroids but desperately needed the surgery? Wouldn't you want the same type of care? Wouldn't you want the same type of care for them as you would want for yourself? Why should it be any different for my family? Why are you trying to force these choices on your constituents? Now is the time for everyone, as Congressman Evans said, to utilize Facebook, Instagram, and all of the other social media networks that are out there, and for everyone to educate people in their local masjid, churches, synagogues, to vote on the Graham-Casey bill, to vote no. You can call 866-426-2631 and give your opinion. Thank you.
Now, here to talk about the impact of this on union members, we have Fred Wright from DC 47.
Good morning, Mayor Kinney, Congressman Evans, and Bobby Heenan was in the room. I guess he left. Brothers and sisters, we are living in the United States under the presidency of Donald Trump. After listening to his rhetoric and looking at his actions, it is clear to me that he is determined to erase many of the things our former President Barack Obama put in place, especially the Affordable Care Act. We know that this health care program has enabled many more people to get health care in this nation and that their lives have improved as a result of it. We've heard from our health care commissioner here in Philadelphia, and other health care professionals have told us that there are people whose lives are in jeopardy if the health care proposal is eliminated. This includes the lives of AFSCME members and their families. We must continue to fight back against the callous disregard for the lives of those in the nation whose health care will be adversely impacted by the action of the lawmakers in Washington, by the way, who have great health care coverage at our expense. We must continue to fight back and make those calls today, call and jam up the phone lines of the men and women who will be acting irresponsibly by voting for the Graham-Casey health care bill. We're happy to hear that Senator John McCain is standing firm on this bill. McCain said, and I quote, "I believe we could do better working together, Republicans and Democrats, and have not yet really tried. Nor could I support it without knowing how much it would cost, how it would affect insurance premiums, and how many people would be helped or hurt by it. With our full CBO score won't be available by the end of the month, we will have the reliable answer to these questions. Is this really how democracy works in this country? Basic information we don't have? Is this the best we can do as a nation? We need other Republican legislators to ask them the same questions and to stand up for what is right. We need to send every one of them a message that will not be moved by empty rhetoric and promises that are no better than those given by con artists or crooks. And all of us need to stand firm, agitate, educate, and organize. And finally, I must say that the economic impact on this state that just had its bond rating reduced because of the budget challenges will worsen, and you and I will bear the burden. That the millions of dollars that this state and others will lose due to the proposed elimination of the Affordable Care Act. No more cutbacks, I say fight back. No more cutbacks, I say fight back. Our collective action kept Obamacare in place before. Let's do it one more time. The lives of men, women, and children in this country depend on it. Thank you.
Thank you. We had two other congressmen who hoped to be here today. I think they probably had scheduling problems at the last minute, Congressman Brady and Congressman Boyle, who also feel the same way. I also want to give a chance, though, to Senator Sharif Street, who is going to, from the state legislature.
Good morning. One, we need to make it clear that Graham Cassidy does not expand health care. It, in fact, takes away health care for millions of people throughout the country. And I say, as a member of the Senate's Health and Human Services Committee and Democratic Chair for Banking and Insurance, we in the Generalists, you shouldn't send us a concept without funding. Representative Evans, U.S. Representative Evans, when he was State Representative Evans, knows good and well that unfunded federal mandates don't work. Governors, Republican and Democratic, throughout this country have opposed this plan because it would send an obligation to help folks throughout the Commonwealth and make sure that they continue to have health care without giving us the money. The Commonwealth of Pennsylvania already is dealing with budget challenges. We've recently experienced a downgrade in our bond rating, which will affect the obligations of Pennsylvanians throughout the Commonwealth because of the State House Republican caucus's inability to act. We do not need the additional burden of making us choose between trying to find additional state money to continue to provide the level of care that people are receiving today or making cuts. I fear that if this comes to Pennsylvania, there will be cuts. I do not have confidence that we will be able to find the millions of dollars to replace the federal money that is being taken away. Make no mistake about it. This plan would cost Pennsylvania taxpayers money. It would shift money going to pay for folks like the young lady here who spoke about having fibroid condition. It would take away that obligation of the Commonwealth to make sure that health insurers cover her. And if in fact we said that that she has to be covered, the federal government's position would be state legislators, if you care about these folks, then you pay for their coverage. And it is unfortunate and unthinkable that Senator Toomey, who represents the Commonwealth of Pennsylvania in the United States Senate, and who is tasked with the role of fighting for our citizens, would try and shirk his duty to protect health care for people in Pennsylvania, and instead try and burden shift to the taxpayers of Pennsylvania, to the members of the General Assembly, and to the governor to find a way to pay for what the federal government is already doing. And so I'm asking everyone out there, yes, whatever state you are watching this, make sure that you reach out to your senators and tell them not to support this. I want to thank Senator Casey for his opposition, for standing steadfast in protecting the rights of health care for ordinary Pennsylvanians. And I want to ask each and every Pennsylvanian who's watching this message to send a message to Senator Toomey that he's got to put the people of Pennsylvania who elected him first. That's people in counties from Erie County to Philadelphia County, from Greene County and Allegheny County all the way up to Scranton and Lackawanna in the Northeast, from corner to corner, every Pennsylvanian and every section of this Commonwealth is better with today's Affordable Care Act than it would be with the Graham Cassidy plan. And so Senator Toomey, put us first in Pennsylvania. Do not send an unfunded mandate that you ask us to pass along to the taxpayers of Pennsylvania. Vote no on Graham Cassidy. Thank you so much.
All right, we have no other speakers, but we're available for questions. All right, hearing none. Thank you very much.